Some GP practices are testing out a new device which would enable doctors to carry out initial investigations for bowel cancer without the need for hospital visits. It's hoped by performing mini colonoscopies, GPs could both help reduce bowel cancer deaths by early intervention and save the NHS millions of pounds. More now from our health editor, Emily Morgan.
Good to see you.
And you.
How are you well at the moment, actually?
Ron thinks he's lucky to be here, something he thanks his GP for. Last year he was diagnosed with bowel cancer. He had called a surgery with symptoms. Dr. Patel examined him that afternoon and knew immediately what it was.
I expected to be going for tests here, there, everywhere, and I was sort of geared up for at least 3 to 5 months.
It didn't take you 5 months, though. It took you 1 day to be seen and referred.
That's right, that's right. Everything happened so quickly that they were able to nip it in the bud, if you like.
It's a traditional rigid sigmoidoscope, which is essentially a tube.
Crucially with this, there's a camera on the end and you can just be looking at the pictures.
Absolutely. I mean, that's the beauty of it.
This is what helped confirm to Dr. Patel Ron may have cancer, a handheld device to do mini colonoscopies in the surgery. It was trialled here and now being used by GPs in parts of the northwest. Widespread use could help hospitals drowning in referrals.
So much of why we have a backlog, or why we have a waiting list, is because we have patients with symptoms and I can't differentiate between benign or problematic. So I have to send them somewhere. But actually, if I can differentiate that at this stage, then actually I've already cut down the percentage I send. So that helps the backlog.
Deborah James campaigned tirelessly to highlight the importance of early diagnosis. Using this device in surgeries could finally improve outcomes.
If we can get something sinister like bowel cancer at stage 1 at the beginning, we have a 90% chance of curing it. If we find the bowel cancer at stage 4, only 10%. And this is a device that is helping us do that.
It's certainly the device Ron credits with his survival. He's been cancer-free for a year now and wants others to also benefit from it. Emily Morgan, ITV News in Ascot.